What are your treatment options for bulging discs? An intervertebral disc is a material or joint tissue that sits adjacent to vertebra, and it sits between two vertebrae, acting like a cushion or a shock absorber or a spacer. And it normally consists of two structures, the inner nucleus and the outer annulus. And this material is a soft gel-like material, and it's the outside annulus is tough enough and durable enough to hold all the gel-like material in place. It provides cushioning between adjacent vertebrae, and it combines forces to facilitate spinal flexibility, meaning in order for your spine to move, we need disc flexibility. And one of the things that can limit flexibility as patients get older is that the discs become degenerated or dehydrated, and they become stiff, and it prevents the spine from moving properly. So it acts as shock absorbers, and it provides the spine with the structure it needs and the space in between every vertebra, so the nerves can exit out into the body and the messages and the information can be transmitted properly. Now, when a disc bulges, what does that mean? It actually means that something is causing the disc to bulge out into one side or to the back, most commonly to one side or the back, and it's pushing the nucleus out towards the annulus and causing it to bulge instead of staying within its confined space. What disc bulge is, this bulge can bulge outwards to the spinal nerve, causing compression to those nerves, or it can bulge backwards into the spinal canal, causing compression into the spinal canal. Now, how serious are disc bulging? Well, it just depends on the size of disc bulge, and it also depends if there's nerve involvement or not, meaning is it bulging enough to press on a nerve? Meaning you can have disc bulges and have no pain or no discomfort or not even feel that you have them. Or you can have a disc bulge and it can cause severe pain affecting the nerve that it's pressing on. And normally it leads to radicular pain, meaning radiating pain away from the area of compression. And the most common area you would feel it is going to be either down your leg or down your arm or up into your head or around your rib cage, because those nerves, they branch out and they go around there. Now, the problem is that once a disc has become bulged and it's sitting that way, it can become herniated. And the difference between herniated and bulging is now in herniated, the nucleus is now pushed through the annulus and is now outside, and it's sitting in this outside space. So therefore, the longer your disc remains bulged, the more likely it is to become herniated through more further injuries or further trauma or further compression. So disc bulges, even though they would a lot of times they discount them, oh, it's not that big of a deal because it's not herniated yet, it can become more severe if left untreated. So what are some common causes of disc bulging? Well, first thing could be disc degeneration or degenerative disc disease or disc desiccation, like I mentioned before. This is when discs become dehydrated or degenerated in an abnormal way, and they become brittle and they become easier to bulge as a result of asymmetrical pressure. Negative lifestyles like carrying excess weight, leading a sedentary lifestyle, chronic poor posture, and some kind of repetitive activity like repetitive lifting heavy objects or some type of ADL or activity daily living that you're doing repetitively the same way over and over and over again can cause these discs to bulge. Now, the thing with discs is that discs are passive materials, meaning they're not contracting, they're not actively involved in any type of movement. They just help facilitate movement by their flexibility. So normally for a disc to bulge, something has to be pushing it. And the discs normally respond to the alignment of the vertebra above and below. Think of it like an ice cream sandwich between two hard cookies. You have two hard cookies on one above and one below, and you have the ice cream in the center. Well, if the two cookies are aligned, the ice cream in the center would be aligned as well. But if you push down on the two cookies, you will create this wedging effect, which will cause the ice cream to bulge out into one side. And that's exactly what happens in disc bulging. It's the most common thing that we tend to see is that there's some alignment causing the disc to bulge. Now, normally in traditional type of approaches for disc bulging, they'd recommend nothing until it becomes severe enough, or if it's causing nerve pressure, then they'll cut out that excess. They'll go in there and cut out that excess amount of bulging that exists. However, the way you can treat disc bulging is to determine the underlying cause, and the underlying cause is normally related to the alignment of the spine. So if you can realign the spine back into its normal alignment, you can actually allow this disc to kind of get back into its normal alignment, resolving the bulge itself without cutting it off. Now, cutting this excess disc material off does have some risks because, like I mentioned, discs are built with a nucleus in the center and annual fibers that go around. Annulus means they go around the nucleus. So imagine the nucleus in the center, and then we have these concentric circles that go out. Well, if you cut something out, you're damaging these annulus circles, so therefore you ultimately make your disc weaker, which make you more prone to injury. So treating the disc bulge without cutting off the excess material would be the preferred method. So what can be done with that? Well, we can use condition-specific chiropractic care to help adjust the spine, to help realign the vertebra, to help allow the disc to suck into place and reduce pressure on the affected nerves. We can use physical therapy and exercises to help strengthen the spine in this new position, so therefore the spine doesn't want to move back into the right alignment. We can also deal with whatever type of repetitive activity that may be involved in causing the disc to bulge to begin with. We can also provide nutrients to help for the disc to repair properly, and the body can reabsorb any kind of material that's actually caused any kind of leaking or herniations may possibly occur. And the last thing is that we can lead healthy lifestyles to help decrease weight, to put less pressure on the spine, to help decrease the disc from bulging in the first place. So treatment has to be driven by finding the cause of the disc bulge, which is normally alignment related. And normally you have to deal with a proactive treatment method that preserves dysfunction without preventing further damage by cutting off the excess material and realigning it, and then providing support for that alignment over time so the spine becomes stronger and more self-sustaining. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.